Thank you for spending some of your time with us. My name is Tina Rosenquist, and this is Knowledge for Wellness. And this show is to enhance your overall understanding of information provided to you, because when you know more, you are empowered to make better decisions, to enhance yourself and your loved ones for a better quality of life. And today I'm delighted to present Dr. Daniel Barrett of Vibrant Life Center located in Oakdale, North St. Paul. Welcome. Thank you for coming back.
Thanks for having me on Knowledge for Wellness.
Yes, it's a delight to have you. And of course, today's subject matter is going to be on influenza, which is also the medical term of flu. And we talked a little bit about that before. And of course, I wanted to point out to our viewers that in the state of Minnesota, it is a personal choice to decide to receive any type of shot. So we talked basically about the H1N1 flu vaccine on our last show, but we want to just sort of pick that apart a little bit in case our viewers did miss that there are the different types of flu, the normal seasonal flu, and then now we have the H1N1. So if you would like to embellish on that a little bit, that'd be great.
Well, H1N1 is just another, no more, no less than another flu. It has some unique characteristics in that there's some evidence that it was manufactured in the lab by vaccine companies, that it didn't come about naturally. So that's one unusual characteristic. And the other big thing about H1N1 isn't necessarily H1N1 itself, but rather how the government and the media is portraying it, despite evidence that says that H1N1 is no more virulent, no more disease-causing, is responsible for no more deaths than any flu in the past. In fact, perhaps less.
Well, I know that, there's a concern about it being a pandemic, in that sense. But also we need to kind of talk about a flu that we receive almost every year, different types of various of different ones that they foresee over in Asia. And then they come and hopefully predict what we're going to receive here in the next few months. And then they go into the lab, and that's when they try and come up with something that will be preventative. Now, it's not always 100%. It's sort of a 1 on 5 chances that we do happen to hit it on the right area. But I want to talk about, people having personal choices. They can look into this, they can decide for their family and their loved ones what they want to do personally. But in your professional opinion, I know that you feel really strongly that there are ways to prevent actually getting the flu. And we talked a little bit about that with vitamin D and nutrients, and I'd like you to talk a little bit more on that. That would be great.
Yeah, the research really supports, well, one is when you talk about, what is your risk? You could get the flu vaccine, or you could take care of yourself. You could do both. The flu vaccine, as you know, isn't 100% effective, and it carries its own inherent risks. So before you evaluate, well, it's easy, it's very convenient just to go get a vaccine. I don't have to exercise, I don't have to make sure I'm taking my vitamin D every day. Recognize that if you do make that decision to get the vaccine, that the vaccine hasn't been tested for safety at all. The vaccine that you will get if you get the H1N1 will have ingredients added to it to stretch the vaccine out, in other words, to get more doses out of it, that have not been tested. So you will be acting as the test group when you get that vaccine.
Okay, but isn't the CDC actually there for us as a blind faith?
Well, here's what the CDC is saying about this stuff. They're saying, H1N1 is just another strain. Like you say, you have to pick another strain, and it's really like, what did I hear them say on the news yesterday? And this wasn't the CDC, but another media proponent of flu vaccine say it's like having a blueberry muffin or a chocolate chip muffin. Oh. It's really just different type of muffin. We really don't need to know all we need to know about this H1N1 strain. We've been making flu vaccines for years.
Right.
But recognize that the safety data has not been in any flu vaccine. There's never been a test that has measured not vaccinated against vaccinated. They've never done that to be able to come up with what sort of things are developing in the vaccinated population. Not just did you have redness at the vaccination site, or did you have a fever? They check you for 72 hours, or follow people for a couple of weeks for things. Things, very serious things like Guillain-Barré syndrome. Autoimmune reactions develop weeks and months later from the permanent changes in your immune system. And you may say, okay, that stuff just happens in the general population. It just happens. Some people are going to cry, before the vaccine was going to be there, some people would die of a heart attack. Some people would develop Guillain-Barré syndrome. Some people would develop digestive problems. Because we give the flu vaccine, that does not mean that the flu vaccine caused it. They were going to have that anyway, but some people are alarmist, and because it happened on or about the time, they would say that is related to the flu vaccine. Reasonable argument. You know what? Reasonable argument to defend the vaccinator's position, to take the devil's advocate if I'm a vaccinator. A reasonable argument. But how about this? Then how about let's just get the answer? How about the CDC or the World Health Institute or somebody, you know, the drug companies aren't going to do this. They're not going to give the money to find out this. It's been shown time and time again, the drug companies hide data that is negative to their drug sales and their bottom line. Yeah.
So we actually aren't actually being introduced to the truth.
The truth does not exist.
Okay.
It isn't that they're hiding it, it's that it doesn't exist. It's like nobody wants to know, which is a very curious position. If you really wanted to know, like I've said many times, the Amish population is out there.
Right.
Heck, you know, I know a whole pile of chiropractors who don't vaccinate their kids. There's 60,000 chiropractors in the United States. That means there's probably 120,000 kids who potentially haven't been vaccinated. You know what? Find them, check it out, get the answer to this, and then come tell me about how safe it is.
Okay.
But with this H1N thing in particular, because they're trying to rush it, and then there's not enough vaccines because some of the early production problems, they're going to add squalene and mercury to at least 3 out of the 5 manufacturers making this.
Okay, but we were told that they were taking mercury out of all the vaccines now.
When they did, to some degree, but you know, it's put back in because it's called an adjuvant. And an adjuvant means the vaccine elicits a greater immune response from your body. And if that's true, if I can add mercury and if I've got, you know, 1 glass of something and now I've got 3 glasses of something, never mind that mercury is damaging, but if that's how it works, if we can add adjuvants and make it more active in your body and elicit a grander immune response so I can use less dose in everybody. And also, it's also true that you can, you know, the way it's shipped, there's a number of things about it. You can keep putting the needle back in the same vial and taking further doses out because there's mercury in it. So there's a number of reasons why that's done, but on the other side of the coin is, hey, isn't that the same thing the EPA is telling us is harmful?
Right.
I mean, you were pregnant. You remember what the EPA said?
I couldn't even eat salmon.
Yeah, right. You can't eat fish because fish eat little fish, and you concentrate toxins and mercury.
Yep.
And you don't want mercury in your body when you're pregnant,
Right.
because that can be transmitted to the baby, of course.
To the fetus.
Cause birth defects. So just yesterday, Washington State changed the law to make it EPA, and it isn't the EPA, it's the state law about how much mercury you get, but the vaccine contained more.
Oh.
So the state just had to change their law to say, okay, now today it's okay to get mercury.
Now this just took place?
Yesterday, and this is
Okay.
the end of September 2009.
Right.
So yeah, in place for years are these, you know, another government agency to protect you from toxins and stuff, but now you have the CDC and their relationship with the vaccine and drug companies, and they're really the folks who kind of put this whole thing in motion. As you said, they got to decide early on what's it going to be, what are we going to have these vaccine companies make for us, you know, and then they guarantee to buy, you know, X amount, and that's what kind of keeps this whole relationship going.
Okay, so can we talk about what it actually is in the actual vaccine? Because I know that I can't read, when I'm reading some of the labels, I don't really know, I don't digest it like you with your education.
It's quite challenging to read,
very.
but recognize the process requires you to capture a virus, which exists, and then culture this virus, somehow keep it alive, and then modify it so it can't necessarily cause the disease in your body. So what we have to do then is you have to get this virus, you got to break it down into little bits and its components. Hopefully those little bits are the same little bits that cause your body to respond to it like it would in the wild. If I inhale the H1N1 virus.
It is airborne.
It is airborne, right. So the virus is this whole, you know, self-replicating organism, but that isn't what's in the vaccine. You actually break it down into just little bits. You have to stick it to aluminum. You have to preserve it with formaldehyde, you know, what you put in, you know,
Your
mortuary.
Yeah. Okay. Yeah.
Formaldehyde is a carcinogen, of course. So you preserve it. You got aluminum, you got formaldehyde, you've got the media that it was created on, which is egg yolk, in some case fetal human tissue. You have ethylene glycol, which is, you recognize